You've got lots of muscles on your entire skeletal system here, okay? But what I really want to share with you guys today are we can also address the muscles of the actual temporal mandibular joint. So sometimes what I'll do with people is actually put my fingertips right in front of their ear. Okay, that's where you can actually find your TMJ or your temporal mandibular joint. So then what you can do is just slowly open and close your mouth. And again, you're feeling for symmetry. You're feeling for a nice smooth glide. You're feeling for clicks, pops, cracks, things of that nature. And you're trying to feel, maybe even do this in front of a mirror. You're trying to feel if that glide of that joint goes straight down and straight back up. I've seen a lot of pathways. I've seen a lot of jaws that are really going side to side and kind of squiggly like this. And this is no bueno. This is not a good thing here, guys. Let me tell you a little bit more about this. So in terms of from a neurological perspective, because that's what we do as chiropractors, right? We're neurologists. And so we're treating the central nervous system. So from a neurologic perspective, you've got a ton of information coming up through your body to your brain, and so much of that is actually filtered through your jaw. Okay, so maybe you've experienced this, or maybe you've seen people like this where they don't have quite a very good gait when they walk, or they struggle to run very fast. And this could be because their jaw is not moving properly. Okay, and you can actually get gait dysfunction. You can get other dysfunctions of the body as a result of the jaw not tracking properly, or the TMJ being out of place, out of joint, things of that nature, okay? So what do we do about this? Well, okay, so let's look at these muscles here. Let's see if I can make this actually quite a bit larger. Let's just kind of blow it up right in front of myself there. Okay, so I think you guys can see my mouse here, but let's see. As you can see at the top, you've got the pterygoid muscles, okay? The pterygoid muscles are really what we're looking at from an internal perspective when we work on this here at the office, okay? So you've got the lateral or the superior pterygoids, and then you've got the medial or the inferior pterygoids, okay? Now, as you can see, these muscles here, these pterygoid muscles, the superior or the lateral actually attaches onto that temporal mandibular joint there, that mandibular process of the mandible, all right? And the other pterygoid, the medial pterygoid or the inferior pterygoid, is going to go ahead and insert on the lower part or the angle of the ramus of the mandible, okay? So these two muscles play a big part in how the jaw moves and tracks. And if you combine that with the buccinator muscle and the masseter, which is actually reflected away in this image, which is your main kind of chewing muscle, working on a couple of these muscles alone, guys, can make a major, major, major difference, okay? So again, you guys might be thinking, hey, it's a muscle, right? So what is Dr. Kyle always recommending? Yes, you guessed it. Bisglycinate magnesium, you guys, so important for any muscular condition. So I highly recommend, if you're having temporal mandibular joint dysfunction, if you're having headaches, if you're having neck pain, if you're grinding, bruxism, any kind of clenching, taking your magnesium is super, super, super important. And again, that needs to be the bisglycinate magnesium to help these muscles of what's called mastication actually calm down and relax. Okay, so by treating these muscles, by taking your magnesium, you can really get a profound response out of these muscles. So hey, if you guys are joining us here live on the video, I encourage you, go ahead, click that link in the description. That'll allow us to interact and actually answer some of your questions, comments, or concerns. Or again, if you're watching the replay, go ahead and put those in the comment box below and we will get to them later. But we were just talking about how sometimes with some people here in the office, we'll actually go inside the mouth, like an intra-oral adjustment, okay? We put on finger cots, we do this safely, but we actually go inside the mouth and we actually do trigger point release, much in the same way that we do a release on your hip or a release on your leg or your arm, something like that. But we're actually doing these releases on these muscles right here in the jaw, okay? So this makes a huge, huge difference. And I can't tell you how much relief people have gotten from just those very standard muscle releases. I talk to dentists and dental hygienists all the time, And I asked them, like, do you ever just do a pterygoid release? Do you ever work on the pterygoids here for your patients that are struggling with temporal mandibular joint or TMJ dysfunction, or your patients that are grinding their teeth, clenching their teeth, okay? This is a major deal. So by simply doing these trigger point ischemic compression on those pterygoids, even the buccinator and the masseter here, you can get a profound effect in someone's temporal mandibular joint dysfunction, their headaches. The temporalis here, guys, too, let's not forget that. This muscle that is not shown here in this image, but it attaches right on the top of the head and then comes down to that TMJ joint. That is a major muscle to address as well. Okay, so we've talked about a couple of things so far. We've talked about the importance of how your TMJ filters so much neurological information that it's super, super important to make sure that this joint is functioning properly, okay? So one of the ways we do that is with buffered magnesium, is with bisglycinate magnesium. The other way we do this is with our trigger point release, in some cases actually going inside the mouth for that. Let's pause there for a second. You guys can actually do a version of this at home, whether you want to put your fingers inside your mouth, but you can actually just take your thumb. Sometimes I do this driving down the road in my car. Take your thumb makes a great hook. You can hook your thumb right underneath your jaw here. Basically, this is your mandible right here. You can hook your thumb right underneath your jaw, and you can actually get at that lower inferior pterygoid there, that medial pterygoid. And basically just hold that muscle, find some trigger points there, find those tight spots, apply some pressure. Now, you don't want to, crank on it, but hold it for long enough to try to get that muscle to release. That's the whole idea, okay? Now, of course, we also pair this with our spinal chiropractic adjustments because, as you know, all of the nerves that come out of the neck there, they're going to these muscles of mastication to help you move your jaw and to move your TMJ. So it's very important if you're struggling with temporal mandibular joint dysfunction, if you're clenching, if you're grinding, if you've got headaches or neck pain, to actually have your neck adjusted here. Very, very, very important. And honestly, guys, that's mainly it. In terms of conservative care, in terms of musculoskeletal care, these couple of therapies alone have been tremendous in actually helping people from a neurologic perspective, from a musculoskeletal perspective. And again, it just blows my mind how many dentists and how many dental hygienists are not addressing this when you're at your 6-month, your yearly cleaning for your teeth there, because they're already inside your mouth and they're already kind of working down in there. I know they're doing lots of other stuff with as it relates to your denticulate fauces or the joints that are your teeth. But this is a major, major, major deal because we see a lot of people that come in with temporal mandibular joint dysfunction, with TMJ, who are just having a hard time clicking, grinding, snapping, popping. And like we said earlier, when your TMJ is not tracking properly, when it's kind of going all different directions, you can actually have problems with your gait. You can have problems with walking and balance and proprioception. So awesome. Thanks so much for the encouragement there and support. Alicia, we go ahead and had a comment there. So nice. It's always fun to throw some comments up. Yeah, if you guys are having any questions, comments, or concerns as it relates to your temporal mandibular joint, headaches, neck pain, that's what we're talking all about today. I do discourage the use of ibuprofen and Motrin. If you're just popping ibuprofen, if you're just popping Motrin, that can sometimes get a little bit taxing on your gut, on your kidneys. You got to worry about your microbiome. You got to worry about your kidney filtration. So in lieu of that, obviously, come see your chiropractor, get well adjusted there. That's always going to be a great solution. If you need something in the moment, I highly recommend the use of omega fatty acids as a natural alternative to fish oil. So let's talk a little bit about that real quick. Omega fatty acids work on the same prostaglandin pathways as do the NSAIDs or the non-steroidal anti-inflammatory over-the-counter drugs. Okay, so if you're taking Motrin, if you're taking ibuprofen, all those kinds of things, and they help, that's important. They have to actually move the needle. They have to actually have an effect. On some people, they don't have a profound effect. Their prostaglandin pathways are not working properly, so the fish oil would not work. So, but if when you take the ibuprofen, you feel a little bit better, then you know your prostaglandin pathways are intact, and that's when you can take an extra gram, I would say like 1,000 milligrams of your high quality fish oil. Okay, so if you guys need recommendations about what a high quality omega fatty acid fish oil looks like, please feel free to reach out. I can make those recommendations. We do that sort of thing all the time for our patients here at the Family Wellness Clinic. And so with that, you guys, let's go ahead and do our usual spiel here. So once again, this has been Dr. Kyle Wallner coming at you live from the Michigan Family Wellness Clinic. We invite you to schedule online at michiganfamilywellness.com. You can also call or text our office with any question, comment, or concern at 734-335-0533. I hope you guys have enjoyed today's live video training on temporal mandibular joint dysfunction and jaw pain and the simple things you can do to improve that. So once again, let us know if you have any questions, comments, or concerns. And with that, we will talk to you guys soon.